bringing back the well life. All right. We're splitting it up a little bit differently. Tyler and I are going to have some together, some separately with various guests. This is how we're doing it. Trying a different approach. It's going to be fun. So we're revamping the podcast a bit, thanks to Steve, MMP, and first official podcast in Bella Vita Studios. Congrats to Steve and Dan. Phenomenal space. So we have on today Mike Fucci, the Mike Fucci. Tell us a little bit about yourself. Well, first off, before he goes, we had him on a few years ago when he was just a chiropractor, right? Mm-hmm. Kind of like, I almost labeled him as like the strength, like the conscious strength chiropractor,
mm-hmm.
right?
I would have taken the name if it wasn't already taken.
Yeah. Wild knowledge just on the body and how the nervous system relates to the muscular system, relates to the joints, relates to a base chiropractor's knowledge, but then much deeper towards, right, weightlifting, movement, idiosyncrasies, rehabilitative processes, really interesting interactions and how kind of everything can be reformed or interacted with another body part in order to drive some progress and results. So, right, within the last year, you've become a functional medicine doc. Mm-hmm. Tell us a little bit about the transition to start and like who you are and who Mike Fucci is as an individual, aside from chiropractic, and then translating into the funk med space.
Sure. So prior to this podcast episode, I ended up going back and looking at the old one. Okay. It lives forever on my website because it's like one of the first podcasts.
We did one with you, and then I hopped on yours. Yeah. Right, a year and a half ago, probably.
A year and a half ago.
Yeah.
So the first one ever, in that episode, I talked a lot about my perspective as I guess what we would call a rehab chiropractor.
Yep.
And in that episode, I had talked a lot about my perspective on the way the human body works and the way the human body moves. And my whole philosophy, and the philosophy hasn't changed, is trying to get to someone's root cause. And this all started out of my injury that I talked a lot about in that original podcast episode, where I had gotten a huge disc herniation in my L5-S1, mm-hmm. and it was affecting my whole leg. I got numb down the entire leg. I couldn't feel the leg.
Like a ton of people out there overall.
Like a ton of people out there. And I actually just got a new patient in last week who had the exact same symptoms. He felt
mm-hmm.
really confident that I was like, oh, like, he's like, you can help me. You experienced this. And the original kinetic chiropractic method, which was the original company that I ran, method came from that, where I had gone to all these chiropractors, I had gone to all these physical therapists, and I never got anywhere. And I was just dealing with this terrible leg pain, and I couldn't feel anything down the leg, and it was just terrible.
Yep.
So I ended up traveling all over the world, studied with all these different people, and it was fantastic. It wasn't until I met this guy from Australia who really helped me with a lot of the neurodynamic solutions materials that he used. Mm-hmm. So once I started learning that, kinetic chiropractic was born, where we're trying to identify the root cause of the problem and get people movement solutions to fix that. We had tons and tons of success. But what I started to realize was that we were getting success with about 85 to 90% of our clients, but then there was this 10% of clients that wasn't really getting anywhere. And I was like, this is interesting. So 10 years ago, I got certified in a less traditional chiropractic version called applied kinesiology, where they do a lot of muscle testing, organ correlation, things like that, where they're really focused on nutrition. Mm-hmm. So I was like, oh, well, the more mainstream version of that's functional medicine. So I started getting more interested in functional medicine.
Interesting.
It didn't become a need for me until I needed functional medicine when I was struggling with depression and suicidal tendencies, because I was just having this was 2023 /2024, and it was all in the background. I tried to keep it covered. I want to talk more about it now because I'm out of the tunnel.
I'm surprised you brought that up. I wouldn't have known.
I tried to mask it as much as possible, but I was living in an apartment, and the apartment was infested with mold.
Oh, okay.
And me and my wife were trying to get pregnant for a year at that point, and unfortunately we just couldn't. It was very disheartening, but I also felt like I was out of control, because I was my health was flatlining. I was getting high blood pressure. I was getting high cholesterol. I was getting all these different types of issues.
From a person that is, let alone practicing everything, let alone helping everybody with all of their issues. And you're like, what's going on here?
I got so depressed. I was like, oh man, I don't know what to do. I was like, this is terrible. I started to drink a little bit more, and I was like, I'm still going to eat food. I'm still going to work out. I was like, maybe I'll try to drink to take the edge off. And it was terrible. It was it was probably my worst year ever. But the
Interesting.
business was doing okay.
Yeah.
So I was like,
Most
I was
best year
helping
in business
people.
probably, right? For
Yeah,
like the chiropractor.
you know, which is tough. And, you know, I don't mean to like monopolize talking about this,
Yeah.
but like I got a lot more into mental health and at that point. But what ended up happening was we had, did a mold swab of our apartment, came back moldy, and I was like, all right, let me try, let's get out of here. So we left the apartment. I at that point was like, I have to do the functional medicine stuff. So I got an entire certification at that point because I was like, I need to know what to do. And I left the apartment. We did a mold detox protocol. We did a bunch of changes in diet to help limit fungal growth.
Wow.
And I kid you not, a month later, Megan was pregnant.
Wow.
So that's why I have such a passion for, one, functional medicine, but also for people with infertility who are struggling, because I know from a functional medicine standpoint now, especially, back then I didn't know this, there's a lot you can do. So that's been my transition, getting more into this, and I've been really exploring the functional medicine world. And, you know, I've had patients with Crohn's disease who are getting better, psoriasis who are getting better. I've had people with chronic pain syndromes completely disappear just from dietary modifications and nutritional strategies. So that 90% of people we were helping is now getting closer to the 95, 96, 97% of people that we can help. And it's really cool, and I'm really excited with that. That's been my journey since the last podcast episode.
Wow.
And, you know, one of the things I've really come to see is that, like, no matter how much you train, no matter how healthy you are, there's still people out there who are dealing with Crohn's disease, SIBO, IBS. You know, we all have family members who have heart issues and stuff like that. And those are the things that are limiting them from training.
Yeah.
So philosophy is still the same. I want to get people exercising. I want to get people living their best life. But the focus has changed a little bit.
Yeah. That's actually incredible. That's crazy how you can take your real life. I mean, your real life is like a case study.
I love it.
Right?
I've always said
For
that.
what it
I'm
is.
grateful for all the shit.
I feel like most people tend to lean towards whatever they do in life because of what happens to them, right? I went through back issues, got into strength that way, right? Trying to be an athlete, but having issues, not being able to lift a certain amount of weight. But it's crazy how it molds you and makes you better for what it is, no matter what little pieces you go through that are the struggle, right? That like is like, okay, that's in your memory now. And it's just like, close it off, right? That door's closed, that room's still in there, but you're moving on, building the rest of the house, right? I want to ask too, within this entire journey, what kind of sets, I mean, it's a loaded question, because how you and I could talk for hours and how much we have going on in our heads about what we do, but what sets you apart in the industry, right? The fact that you're just a chiro and a funk med combined, but totally different kind of totally different depths and processes and rabbit holes of like real applied stuff that people don't know about. What are some of the standards in the industry that people accept, and what are some of the things that kind of you've seen that differentiate everything that you're doing and why you're doing it, without being
He's like be concise
without being harsh and
be concise and nice,
controversial, but what's the reality for people? Because I've tried to refer bunches of people to you just in conversation, but not almost the direct referral of saying, go to this guy, he's a chiro. It's saying, you know who you might like, right? Phrasing it differently and saying, this guy is, you know, a bigger kind of neuromuscular, patternized chiropractor, but also now has a whole funk med practice that actually dives deep into the examples of, the Crohn's stuff you've helped with, all these different factors and stuff that we've chopped it up over the last few months about. What is that, right? Like, what's the difference?
So the thing I'm going to say, and I'm going to try and say this as nicely as possible.
Yep.
We're taught a lot of stuff in school. And a lot of people learn a lot of things without understanding how to apply it. So everything I've learned, I'm relearning again for like the second time. And what I mean by that is, like, let's take, for example, the liver. Everybody knows that the liver exists. Everybody knows that we have a liver. What people don't know is how the liver manifests as a problem, especially subclinically. So to even jump off a tangent of that tangent is...
No, this is a perfect specific example, right? It's almost like a good way for a lay person or an average person, even myself, to digest what you do and how you look at it, right?
So let's take it from this perspective before we even tackle the liver. Most people when they are thinking of a physician, they think of someone who's there for when they're ill.
Yeah.
And they are too far gone for what they would consider nutrition, dietetics. You have a nutritionist.
Yep.
I think most people should be seeing the nutritionist before they see me.
Or registered dietitian.
Or registered dietitian.
Yep,
Apologies.
Yep. Sorry, Nick.
Sorry, Nick. Nick's the best. I love Nick. So the point being is that when someone goes to see a physician, they think that they need to be ill.
Yep.
They don't need to be ill.
Yeah.
Most problems manifest subclinically. And what that means is that they don't show up on blood work, meaning that you don't feel well, but you don't know why.
Interesting.
So you go to your doctor, you're like, hey, I'm really feeling like my, so like when I was dealing with a lot of depression, I was dealing with a lot of like suicidal tendencies and thoughts. And it's like, I was like, okay, I'll never do anything. I'm here. I love my wife. I love my family. I was just like, I don't know why these thoughts keep happening. And it's like, once you start understanding the pathways of how these things start to become, then you can start changing those things. And a lot of it comes down to patterns. But before we get into that, it's you go to the doctor when you think you're not feeling well. They run all these labs and everything comes back fine. Or you get standard level stuff like high blood pressure. That's not a diagnosis. That's just a statistic. It's a way your body's it's a measurement.
Currently functioning at that
it's the way your
state,
body's currently functioning. And even going deeper level, these people are given these diagnoses or diagnoses which aren't diagnoses, and then they're associating that with their whole life. I have high blood pressure. I'm a person with high blood pressure
or high cholesterol, and they're that right. It's just it's what is the determining presence of this, or is it right? It's just a health marker, right? And how many other health markers come up that pinpoint X,
right?
And
in school, and I know many medical doctors aren't really trained to dig deeper. They go, you have high blood pressure. We're going to monitor this. Maybe, and I've talked to medical practitioners before, and they don't get education on nutrition. I actually had a conversation with a medical practitioner once, and it did not end well. They were like, I don't believe nutrition and supplements work. Only medications work. When supplements get pushed as medical pharmaceuticals, then I will recommend supplements. And I was like, how can you say that nutrition doesn't make a difference? But regardless of that, because it's just basic biochemistry.
Sure.
Regardless of that, they're trained to identify a number, and then they treat the number.
Of course. There's a certain fixed protocol.
Right.
There's a certain fixed protocol. Just like hospital setting, right? My fiance's a nurse, and seeing the practices of things, it's just XYZ equals this. Do it in the hospital setting because this patient has, DJF symptoms, sickness, this. That's it, right? But like, okay, where's everything else? It's like, well, the system's not going to be equipped to handle that based off of the building of it, the education of it, and the straight line that it's been on for decades, right? Think about cracking and totally breaking and revamping that whole system is going to be
hard.
It's already trillions of dollars. It's going to be quadrillions, right, of dollars to break it, right?
I'll have to make up numbers.
Continue, but.
So when someone's getting there with this, these are early warning signs sometimes of maybe there's some sort of metabolic dysfunction.
Sure.
And the problem is the lab tests that we're running are usually later lab tests. So from a lab testing standpoint, there's always earlier markers that we can run to identify when there's dysfunction earlier on. But again, the point being is that we're trained to treat a number. Even in chiropractic school with my program and background, I remember like we learned how to identify cranial nerves. And they teach you that, and then that's it. They don't go beyond that. They don't teach you how to use it.
Interesting.
So now I'm on
that's like, just basic kinesiology degree.
Yeah.
Oh, wow, you have that. I'm like, yeah, they think, right, an average person's like, wow, you must have learned so much about what you do, and that's why you do what you do. I'm like, well, thanks, but they taught us A and P 1 and 2, and the application is zero, right? Like, how does that relate to movement, to diet, nutrition, how someone's sleeping, how their nervous system's functioning, and then go back around to say like, okay, well now I know what muscle they might need to have, or they're having problems with, or they just tore, it's like, okay, well, where the hell's the application for any of it?
A lot of it's straightforward.
Yeah.
So like in chiropractic school, we're taught to do a assessment of the nerves, right? And the assessment doesn't change. So like at this level, like I'm trying to investigate how we can utilize the assessment to interact with things. So like, for example, you're taught a patellar reflex where you hit the patellar tendon, you hit the knee jerk, and you're like, oh, that's great. You're taught to do that in school as part of this like rudimentary analysis. But what happens is they don't teach you what to do with it. they don't teach you that if someone's having tics, that you could potentially hit that reflex, and that might actually short circuit their tics. So you can actually use both the patellar reflex as a therapy because of the way it activates certain muscle spindles, or you could utilize it as just an assessment of maybe their nerve functioning. But then they don't teach you how to treat based off that. So like I have a guy who has foot drop, and the example would be like, I did all of the neuro tests that we learned in school, but then I knew how to treat the nerve to be able to rehabilitate it, and now we're seeing those neurological signs improve.
Okay. And foot drop in
for
basic terms is
it basically means that you can't lift your foot
lack of dorsiflexion or
lack of
lifting
dorsiflexion.
ankle up. Okay.
And that affects different muscles. So
Gotcha.
sometimes it affects anterior tibialis, sometimes it affects the peroneus tertius, which is like a muscle on the outside of the leg. And it depends on which one and which part of the nerve fibers are affected, and then you'll get that. But basically it means like this guy was walking in with like his foot dragging.
Yep.
And he didn't have power output to that foot. So if you think of it as like the vacuum's not turning on because it's not plugged in. So we have to go in and figure out, okay, well, what can we do? Do we need to fix the cord? Do we need to fix the outlet? Do we need to fix the actual vacuum itself? So it's kind of like one of those things. And I always tell people, like, everything we do is the same. If you're an electrical engineer, it's the same thing as working on the human body.
There's a circuit to it. Yeah.
There's a circuit to it. There's a pattern.
Yeah.
And when people know this pattern, it's good. So tying back to the liver, subclinical liver will typically manifest sometimes as elbow pain, sometimes as shoulder pain, a lot of times on the right side. Actually, one of the big things that I've been seeing liver be associated with is sciatica, because what happens is you get a backup of the venous drainage, and when you don't have good backup of the venous drainage, you lead to that swelling. We've talked about swelling before, and people think that they don't know why they have swelling. So there's all these different things.
Yeah, even myself currently, after I fractured my fibula August 3rd. Right. Pretty bad fracture. Didn't need surgery, but going back to just how my body functions, and I am healthy. I am moving a bunch, and I'm going to move more than they tell me to move, right? Because just that's who I am, but within reason.
I think that's good.
But getting back, right, texted you, I don't know, probably a week ago, like, hey, feeling good, little achy, no residual effects after I work out, which I did plyometric work, landing stuff, skipping and stuff the other day, little achy during, zero the next morning as if I'd worked it. So it's there. It's strong enough. It's just the response, but there's still... As soon as I work out, right, like I said, micro swelling just around the whole bone on the outside of the ankle. Then it goes away, and I can see the vein through the skin the next morning like it's normal. I'm like, interesting. And you're like, oh, that's lymphatic drainage. There could be a couple issues in here, a couple ways to kind of work that. And it's like basic but complex things, right? Like the body has a system and a mechanical unit.
Body's really smart.
But how can you enhance it or make it better or fix one little point somewhere in the body to keep that chain connected,
The simple phrase I've started to explore is that when the body has a problem, there's either two reasons. Something's in it that shouldn't be, or it's missing something. And it's very, very, very blanket statement, but it works really well, because if the liver's not functioning, we just assume, and I assume this with a lot of autoimmune diseases too, there's a reason that we have an autoimmune disease. There's a guy, his name's Mark Anderson, and he does a autoimmune presentation through Selene River Press, which I think is a fantastic autoimmune presentation. And he talks a lot about how the autoimmune disease is the body's way of preventing that body tissue. So let's say like for Crohn's disease, if there's high levels of cellular tissue destruction, aka like the small intestine typically is the one that's mostly affected in Crohn's. If that small intestine tissue gets into your blood, that's really bad.
Interesting.
That's kind of how endometriosis works.
Gotcha.
Endometriosis is one of the few conditions that can kind of bypass that autoimmune stage, and then you start having uterine tissue grow anywhere.
Wow.
What's actually really cool is that the only place that they haven't found uterine tissue, as far as what I have seen, is the spleen, because the spleen has really good autoantibodies against a lot of things.
Interesting. That's wild.
Yeah, so basically, the way I look at autoimmune diseases is that it's preventing a lot of that tissue breakdown from entering systemic circulation, and you having liver cells or gastrointestinal cells in your shoulder, in your bloodstream, and other places. But now that once we know that, we can start employing different strategies to start healing the tissue. Then we work back on retraining the immune system, and then there's this pathway versus most people are getting immune suppression therapy because they're just trying to downregulate the autoimmunity and go through this process of now maybe they're going to get sick more because their immune system's not functioning as much because they're on immunosuppressants. So it's really challenging. And these people come in struggling. They're coming in so sick.
Yep.
And that's, it's unfortunate. But that's kind of where we're starting to see some of these like manifestations of these like processes get a lot better.
Wow. So what are some of the eye-opening or handful things? Like, give me an example or a couple examples of some common, I don't know, predicaments, right? That either the medical industry or the individual deems, I'm just with this is me for the rest of my life kind of thing. What are some pretty common things that you're starting to see that are either reversible, fixable, or very damn well near treatable, like with what you're seeing in the industry, in the funk med world, in the world that's beyond just take a pill for X, right? Where there's all of these different protocols that can actually fix it and reconnect the chain or the circuit.
That's a good question. So I'm going to talk about some stuff that's not 100% determined yet.
Sure.
So
let's nerd out. Let's nerd out because I want to hear it from your perspective, because there's never ever probably going to be clear answers for everything.
At least not for a while.
At least not for a while, but also who knows the individual's predicament, I guess. It's an individual basis, I'm sure. But dependent upon what your findings are.
Let's talk about it. So for the people out there who are struggling, suffering, they don't know why they have symptoms, there is an answer. I want you to know that there's an answer. I'm going to be giving you stuff that's hopefully somewhat pretty science-based, but also maybe like not in the research yet. And this is just stuff that I've kind of gathered from resources, research, courses, other practitioners, even stuff that I've seen myself in my clinic. So the first one is, we talked about autoimmunity already, and how I like to think of the autoimmunity as the body's way of preventing the tissue destruction that's probably already occurring from going global. So a lot of what we were seeing with, let's talk about COVID, for example. It's known that COVID does affect the heart.
Okay.
So what we're seeing is, like, I had a colleague of mine get really bad heart issues post-COVID infection. It doesn't happen in everybody, but what ends up happening is the COVID will cause destruction of the muscle tissue in the heart, and that muscle tissue then goes systemic, and then what ends up happening is you get some level of potential autoimmunity. And what we're starting to see in a lot of the research is that there are autoimmune antibodies being produced towards heart tissue in those cases. And what's really interesting is that there's a lot of cases in a lot of different things where there's, so like even let's go to like thyroid conditions. Most people have hypothyroidism years before they ever get diagnosed with Hashimoto's or Graves' disease, where we actually start getting the tissue destruction. But what we're also seeing is there's a component in the brain called the pituitary gland. That is considered what is the master hormone gland and controls everything else. So the hypothalamus secretes the pituitary, and the pituitary will secrete to everything: adrenals, testes, ovaries, thyroid, et cetera, et cetera, et cetera. So it's wrong for us to assume most of the time that when we have a thyroid problem, it's a true thyroid problem. Sometimes it's the pituitary gland, and maybe the pituitary gland needs support. But now what we're seeing in these autoimmune cases is that there's also anti-pituitary antibodies. So in Crohn's disease, it's very common for us to actually provide, there's a company called Standard Process. They make what's called protomorphogens, which are cytosol extracts. So for people that don't know, there's a nucleus within a cell, and that nucleus has nuclear proteins. It's the nuclear proteins that the antibodies react to. So what you can do, and this is, again, this is not well researched yet. It's starting to come out with more research on this. You can take protomorphogens, which are those similar nuclear nuclear proteins, and you can use those as decoys for the antibodies that are in systemic circulation, because they'll bind to those first.
Interesting.
So what you'll see is if you have someone who has like lupus, or you'll have someone who has Hashimoto's, if you give them, or Crohn's, if you give them that type of PMG, so it'd be like dermatrophin PMG, because they don't make a gastrointestinal one, but the skin and the gastrointestinal cells are very similar because they're both epithelium. You can give a pituitrophin PMG for the pituitary. You can give a thyrotrophin PMG for the thyroid.
Wow.
So anything. And then what you'll notice is those ANA markers, which are the measures that they use for autoantibodies, will come down because you're using them up.
Yep.
And what's great is then these people feel better. It's temporary.
Yep.
Because you still have to heal the tissue.
Yeah, because there's still a source, right? It's just eating them up almost.
Wow. The mold thing is a big thing for me, because one, it's close to home.
I was going to ask that, because I mean, I've heard multiple people just talk about, whether it's podcasts or just in person, of like mold, whatever, right? Mold is a big problem. The strains, the whatever, right? But you don't know almost.
So many
you're
fucking
not,
strains.
You're
Excuse
not,
my language.
Yeah, no, yeah. Fuck.
I can run a panel and it's like, I'm like, there gets to a point where you learn all the pronunciations of all the mold toxins and you just get a new one. You're like, fuck, I don't know.
Yeah, because you get like black mold, right? Is like the one that everybody would always know in the basement. It's dark, it's moist, there's something. Get out of the house if it could go in the right. Like it can be present in so many different areas, I would assume, and everyone is in a living space that was constructed at some point or another by who knows who and by what company and how long ago and what were the conditions. Even new places, I'm sure, like run into issues, right? So I guess it's a source of like weather conditions, all different, right? Like, yeah, I mean, I guess build your houses out of metal and glass. Seen those like shipment container homes. But it's wild. So dive into the mold thing a little bit, because I'm just curious on how many people out there are dealing with chronic headache or feeling like they're dehydrated, or right there's I've even heard like coffee, right? I try to get organic mycotoxin tested, or mycotoxin, right? Mycotoxin or
mycotoxin
micro or myco. I've heard
it's myco.
Okay. Mycotoxin and mold tested, right? Coffee. We've recently been only really ordering and drinking coffee with that, sourcing, lab testing, everything like that, for this matter. But like, I don't really know what it's doing. I've heard it could dehydrate you more. It could cause more of a crash after the caffeine, because you're almost throwing mold into your system now. It could be a different toxic effect. So that's just a specific thing that runs through my mind when I have a cup of coffee. But
see, the problem is with TJ, he does all the right things and doesn't necessarily always know why he's doing them. But you're doing the right things.
I try to.
You have a good understanding of it. Like I'm assuming you probably have grass-fed butter most of the time. There you go. So it's like you're always doing it. Do you know the ratios of fatty acids in the grass-fed butter? And it's like, no one does. No one fucking does. But we know there's more omega-3s in there.
I'm wrong.
So right. But that's what I'm saying. Like, people don't normally necessarily care, and that's why like I do really appreciate the like social media and how much like free information there is. Because a lot of people, when I get them, like most of the people who see me are the people who have like, I've tried everything and nothing works. And it's not like if I got a case where someone came in and they're doing all the wrong things, one, that's super overwhelming, but two, it's also like, oh, we have a lot to do here. The hard cases are where, like the Crohn's disease case, where they're doing all the right things, they're avoiding all the right foods, but then I have to really dial in, and it's like, okay, you start running a food sensitivity panel, and it turns out they're sensitive to all the foods that they thought that they should be eating.
Gotcha.
Because they're Crohn's friendly, but they're not for her. You know what I mean?
Yeah.
So regardless of that, for the mold, the mold's really interesting because a entire household could not be affected by mold except for one person. So mold is a sensitivity spectrum, and even just a talk about fungi as a whole, diet is really crucial in fungal growth. So if you're eating a diet that's full of yeast, that's full of, so like kombucha, for example. Kombucha is considered a health food. In people who have SIBO or people who have fungal overgrowth, we'd probably want to take kombucha away because it usually has yeast in it. Same thing with beer, same things with that. Sometimes if you can get a bacteria made one, it's a little better, but it all depends on that. Like for example, like sourdough bread will flare up someone who has a fungus if it's made with yeast, but traditional sourdough bread is made with bacteria. So if you get a homemade traditional sourdough bread from like a sourdough starter, people will swear by it because they'll be like, oh, I could eat sourdough bread and I have no problem. But they don't know it's the yeast that's causing the problem. So with the mold,
that's interesting.
You can have an entire family that is totally fine except for one person, and they're always chronically sick. And they don't understand that. They're like, oh, little Jimmy or little Susie is always sick all the time. We don't understand it. We're never sick. But it's because they have a low level of mold that she's the only one who's sensitive to. So mold's a huge sensitivity problem as well. Now, when mold gets into the system, it can do a lot of things.
So is that like mold sensitivity or like allergy to the specific strain, as if someone has a food allergy? Or
that's a great question. I'm not sure the
Well,
exact
because it's not like
behind it.
anaphylaxis, right?
No, no,
You're
no.
not like
No. So if it was anaphylaxis, it'd be an IgE mediated response. So the difference between the immunoglobulins, there's IgM, IgG, IgE, IgA. IgA is usually measured in what we call submucosa.
Okay.
So if you have an IgA mediated response, it stays at the mucosal level. That feels like sniffing, runny nose, coughing. And it'll typically stay there. Sometimes it can manifest all the way down to the intestinal tract if you're really sensitive, but like that's what it'll usually manifest as. And people feel that pretty quickly. So like, I don't know if you've ever eaten a food where you're like, man, my nose is running. I feel congested. I feel...
Maybe just because I overeat some meals.
Yeah, but any reaction's a reaction.
The only
right?
reaction I really had that I think was a real reaction is happened years ago, and then last year was mango, the juice.
Okay.
Got right here, started creating like a little patch.
Okay.
Like a dry patch, almost like a Hy-Vee patch, but it's just like, I was reading, it was just like, okay, some people can have an allergy to like the enzymes in mango juice or some citrus fruits.
And that's a pretty quick response.
Like mango specifically, right? Other than that, a lot of other citrus fruits, I don't really have an issue, but mango specifically was pretty much the only one. Yeah.
So IgE is a response that we typically associate with anaphylaxis. So those are usually the quick responses. So they're going through that different type of immediate immune response, like they're attacking themselves. And then you have IgG, which is the one that we measure typically in the office. That's a delayed hypersensitivity response, meaning it's like it could be anywhere from 0 to 72 hours later. So you might get food sensitivity responses up to 72 hours later. And that's where it gets hard to track sometimes, because you might have gluten today and it could react to you anywhere between today and 3 days later.
Yeah, I mean, I saw that more. My dad and sister are celiac, but my dad, probably like 2007, 8, 9, he started waking up with symptoms of like, what the fuck is that? Like ringing in his ears, certain equilibrium things, brain fog, headaches, some like gut issues, but like the day or two after sometimes, as far as I remember. And it is celiac, but he even found out recently that it was, he switched coffees to a mycotoxin mold tested coffee, and he was going through like different kingdom, phylum, class, right? All like the different things of plants, and like he was drinking green tea every day, chamomile, certain weeds and certain families of the same whatever it was that was producing the same exact protein or strain in those related families of plants or veggies, stuff, even oils, and he was like staying away. And then he found out that it was actually certain mold in the coffees that he was consuming, and he started going clean coffee, and his issues were almost gone. He was developing a rash with certain foods but not with others. Really interesting, like specific things.
So this is where I've now gotten, so I talk a lot about the food sensitivities, because I will always, if someone has food sensitivities, I'll usually take them off the foods that they're sensitive to for time being. The problem is, and this is now what I'm starting to experience in my office, so we're talking about clinical versus research based. Clinically, if I get someone completely like get rid of their, like, let's say they have parasites, and the US, most doctors don't believe in parasites. They think it's a third world problem. It is not. Parasites exist everywhere. Like
sushi.
Like I went to school in Seneca Falls. They used to have beaver fever warnings. Beaver fever, it's caused by Giardia, and it, like, when you go into the lake, it crawls up you.
Really?
Yeah. It's like, I'm like, so upstate, they're like, oh yeah, beaver fever, and then down, you come down here where everything's like hunky dory and we're all healthy, and it's like, they're like, beaver fever, that's a third world problem.
Fake.
I'm like, no, that's upstate. Like, but when you have some semblance of parasites, when you have some semblance of bacteria, when you have some semblance of microbes, could you have a delayed hypersensitivity response to them? Sure. But typically they're secreting some sort of stressor to the system. And what I found almost every time is if you get rid of, and again, I don't know whether this is a leaky gut phenomenon or it's a total toxic burden phenomenon. So for those that don't know, total toxic burden means the amount of shit that you have in your life that it creates this toxic load on you. So it's like a combination of like EMFs, the food you eat, the like problems you have, the environment you live in, all that stuff creates a toxic burden that your body has to process through. For leaky gut, pretty much there's these tight junctions that exist between all the intestinal cells, and they should allow certain things through but other things not. As there is micro damage just like, when we do any type of micro trauma to anything else, gaps form between those tissues. And what ends up happening is bigger molecules can pass through. There's some research that suggests that any time you eat gluten, you have transient leaky gut, and then it lasts a few minutes and then it goes away. And that's why those people tend to have like that, like, the runny nose, the congestion, the coughing, maybe after they have some bread, or they feel like a little different, or they feel a little swollen, whatever. So those key components are there. So I don't know whether it's which one it is. I just know that every single time we get someone off of their, like, if they're like fungal overgrowth with mold, we get them cleaned with that. We get the bacteria taken care of. We get the parasites taken care of. A lot of times also heavy metals becomes a problem.
Okay.
And once we get all of those out, we can usually put the foods that they're sensitive to back in, and they're not sensitive anymore.
So the big three almost might be like a mold, a heavy metal, and what was the third one?
Parasite or bacteria. Yeah. Bacterial overgrowth is kind of like your own bacteria are outgrown. So it's there's a bunch of bacteria.
Well, that's like probiotic, right, versus like a SIBO or something, right, or something like that. Could be. That's how I process it mentally, right?
No.
Yeah.
So, well, most people believe that taking a probiotic is good, and what's actually really interesting is that we're starting to see that the incidence of SIBO has increased a lot more in the last decade.
Because you're still feeding that?
Because the probiotics are what's feeding the SIBO. And what is SIBO? It's small intestinal bacterial overgrowth. There's a certain amount of basically what's happening is large intestine bacteria are getting into the small intestine. Wow. So we could talk about like there's like manipulations that you can do for the ileocecal valve from a visceral mobility standpoint. But then on top of that, there's like diets that you can do to be able to like regulate those bacteria. So what we'll do in the office is we'll try to figure out what the key driver is, and we'll just attack it. So sometimes we need some sort of antimicrobial, antifungal, herb that we can use. It knocks it out, and we're getting really good at pinning down exactly what needs to be there.
But you have a wild collection of herbs and canisters.
I have so many herbs and canisters.
Steve's coming. I'm gonna call Steve. You have no idea. In his office, like a month ago for my anchor 3 weeks, I was like, "What is this?" It's like there's like it's got to be like I don't even know 20 by 20 of vials of just like what you'd see is like a vitamin.
Yeah,
right.
And that's basically what it is. It's like a vitamin or a liquid herb or tincture. So years ago, I got trained in applied kinesiology, and this is like I don't know if you've ever seen like muscle testing and stuff like that.
I mean, I don't know.
No,
bicep curling.
No, but the idea is that if I take a supplement that you need and your body needs it, there will be a positive response.
Okay.
If your body doesn't need it, there would be a weakening response.
Okay.
And it works pretty well. I got trained in it 10 years ago. It was so non-mainstream. It's becoming more mainstream now, but it was so non-mainstream 10 years ago. I struggled trying to figure out how to integrate it. So I kind of abandoned it. So that's why I ended up going the functional medicine route, because I was like, this is scientifically based.
It's more,
and I can validate this. Now that I have the scientific data, I'm going back and I'm rechecking all my cases with the AK stuff. And I'm asking patients who I like and trust that I'm like, hey, can I do this weird thing with you? And then I'm doing this weird thing with them. And like, let me tell you, like the lab results to the AK stuff is almost neck and neck.
Wow.
So like I'm now getting like similar information about mycotoxins, mold, heavy metals with the testing in our office as with the lab results, and we're saving people like $2-3 grand because then we don't have to do the testing.
Wow. So with the mold, going back to that, what are some of the common symptoms that someone would experience if they're in an apartment, thinking about where they are or their environment, and what are they feeling half the time?
So
is it direct or severe compared to your case typically, or is it like I'm always
they're pretty
congested at
severe.
night? I don't know. Like
it varies.
Okay.
So I'm going to put it out there just so that way people know, if you are dealing with mold in the air now, like, because now we're talking about like the difference between food mold, because like let's say I run a mycotoxin panel on you, and what I'm checking for is your body excreting mycotoxins in the urine.
Okay.
Right. So if I see that your body's excreting mycotoxins in the urine, it means that you have mold producing mycotoxins in your body. Therefore, it's coming from somewhere.
Is that like almost every single time they're secreting that in their urine from
The only
that
case would be
exposure.
if they can't process the mycotoxins.
Okay.
But they would be really, really ill. Like you would
Mm.
expect that person to be hospitalized.
Because it would be stored in them pretty much.
Because you'd be
and
stored in
they're
them.
not
Yeah,
secreting.
you're not
Okay.
secreting them. So as long as you're secreting them, you're processing through them, and you're getting them out into the urine, usually you're making them water soluble, your liver's breaking down. But those are people who will have liver problems and not understand why they have liver problems. And again, it could manifest as gallbladder issues. It could manifest as reflux. It could manifest as like anything because their liver's backed up. It could manifest as sciatica because their liver's backed up because it can't handle all these mycotoxins. Actually, one of the cases, and this was my wife, the mycotoxins were affecting her reproductivity. And I'm more sensitive than she is. And she will be happy to say that I'm saying this on camera. I am a more sensitive person than she is. I feel
sorry.
what?
I'm sorry for that, Mike.
It's okay. I've grown to accept it. But I react a lot. So her decline was a lot slower than mine and a lot less dramatic. But what it might have manifested as was, 20 pounds of weight gain and feeling fatigued. And for her, not being able to conceive a child. We don't know which one of us it was. We didn't get down that rabbit hole.
Gotcha.
I knew I had the mold. And I was like, I have to tackle this because I'm like barely surviving.
Yep.
So she ran the same mold protocol I did. So I can't tell whether it was her or me, but her hormones got way better after we got rid of the mold because her biggest issue is that she has a backup of estrogen in the liver because the liver is what clears estrogen. And I think it was estradiol was the one I think that we tested her for, and that's what she had, like, came back super high on. And it just gets stuck in the tissues, or it gets stuck in the liver, and then you can't process it because the liver's too busy trying to process these mycotoxins. Does that make sense?
Wow. Yeah.
So now
That's crazy.
as a
It's
person,
unbelievable. Because there are so many cases of people trying in today's world, and it's like you listen to social media and who knows what's internal versus external. Like there's too much EMF radiation and your phone's Wi-Fi is causing you not to get pregnant. It's like, okay, well but
how do you know that?
What internally actually could be a bigger problem and threat that's not, it's like undercover or in the background or you have no idea.
Right.
You know?
And I think that's the crazy part with all this. But with the mycotoxins, they can manifest in a lot of different ways. So a lot of times it's fatigue, the sinus issues, like someone who has a chronic sinus infection usually has mold in the sinuses. I think the current research that I've seen is somewhere between 90 and 95%, might even be higher, of chronic sinus infections are fungal, which is why antibiotics don't work most of the time.
Because everyone goes back to like, I have a deviated septum, or I have XYZ, or I had this when I was a kid and it's my genetics.
Right. And you probably had it from a kid because you had mold in the house and you probably don't know. My favorite question to ask someone is, it's called never been well since, because when was the last time you felt good? And I'll take them go all the way back. I'll make them close their eyes sometimes and meditate on it because I'm like, I need to know. And like for a lot of people, it's like, oh, I got mono in college and then all of this started. And it's like, well, boom, we got our answer. We're tackling the mono first because your body might still be holding on to the mono.
Wow.
So yeah, I've seen those cases, and it's like you start tackling the mono. With mono, you got to be careful because you don't want to reactivate it. You don't want to reactivate it too much. But we tackle that, and then like same thing with Lyme disease. It's like, oh, I felt great until this camping trip, and then I got bit by a tick, and then ever since then I've been terrible. But mold, Lyme, those are big ones that that really wreck people's lives, but are really like doable to deal with.
And then we had this conversation at your office, parasites. Most people probably have them because we're living
Most people
organisms.
don't want to know
I would assume. I mean, but it's like normal. It's like germs and bacteria are everywhere. A clean freak used to be like, oh no, I can't. It's like, no, it's literally everywhere. So just calm down. All right. Most people eat sushi or consuming things, right? In a world where the U.S. tries to produce the most engineered food for mass populations, but then you have certain quality effect matrices of food. It can be different from other countries. I don't know what the effect on that is in the United States with parasites in that sense. But what have you seen with symptoms for parasites, and what have you seen with not that you know where they're coming from, but where could they be coming from in that sense?
So this I'm gonna tie this back into the mold because
and then we also have to talk about your experience with cleansing your parasites.
My parasites. Oh Jesus,
we have to talk about that.
You're leading up to this one. So first off, mold, parasites, Typically, heavy metals people get a lot from drinking water, which is why it's really good to have a good filter. Nothing gets everything out unless it's like steam distilled. But then you're also then losing some of the minerals and stuff like that. There's this myth that you can't drink distilled water. I drink distilled water. It's totally fine. You can add the minerals back in if you want, but like it's totally fine to drink distilled water. Do you want to make sure that you're not, if your diet's deficient in minerals, like then you're going to be even more deficient a little bit. Yep. But as long as you're getting the minerals and electrolytes back in on the back end, you're fine. So going into the mold can grow on any food.
As we see,
right. we see it tons of times.
Yeah, but then, when you see it, it's already growing, right?
Well, what's funny, and like this is the stupid part, and hopefully I'm telling you this because someone like somewhere like connects it off of them. Yeah. When I was living in that apartment, we could not keep food. It would grow moldy so fast, right? Like so and I would sit there and go, the food's just bad. The food's not great, and I'm like, wait, no, maybe that was the warning sign I needed. Because, like, have you ever gotten, like, not real bread, like Pepperidge, or like Wonder white bread? Mm-hmm. That shit does, like, not grow mold. Mm-hmm. Or it lasts a long time before it does. Like
the McDonald's hamburger that they have in their car for a year or so, or fries or whatever, right?
Stuff like that, which I don't like to eat, but, like, my wife will sometimes buy. I'm sorry to, like, throwing her out under the bus on that one. That grew mold. And I don't know how I did not put 2 and 2 together. Yeah. But again, like most people aren't putting 2 and 2 together. So I'm hoping that for someone, this is like an eye-opening thing for them. So with parasites, you get parasites anywhere. What's really cool is that if you start to study history, and there's I'm blanking on the name of this book. It's Nutrition and something. It was by a dentist, and I'm totally blanking on the book. I have it on my shelf that I need to finish reading. And what he did was he went throughout all these different tribes in Africa, and he looked at dental records for the past like 100 years, and like looking at skulls. And what he was noticing is that there was less arthritis than what we see here. Their dental issues were a lot less. They were able to survive cases of tuberculosis without modern medicine, and it's all because that they were eating foods that haven't been processed like what we're eating here. And their foods had more nutritional value and so on and so forth. So tying into the parasites, you go to Japan. Japan should be loaded with parasites. Everybody should be like having like crazy
huge
diarrhea.
Fish country, lots of water, and sushi all the time.
Sushi all the time, right? Tons of fish. Do you know what's a great anti-parasitic? What do you eat with sushi?
Soy sauce.
And?
Ginger.
And? Well, ginger, yes, but and?
Wasabi.
Wasabi. True wasabi, not the green horseradish that we get.
It's like yellowish, straight up.
Yeah, real pure wasabi is an anti-parasitic.
Wow.
So for years they didn't have, because what we have now is we have really good, and if you ask any nutritionist or a registered dietitian, they'll tell you we have really good safety protocols for food now.
Yeah.
Which is how we're avoiding a lot of this, and why most doctors don't think this exists. But we can't control what travels over here, what gets cooked, how it gets cooked. Yeah. So that's the risk you take when you're eating out, right, too. So what we don't have is we don't have that true wasabi anymore. Nobody's handing out wasabi.
That's
expensive.
Crazy.
So using green
need to get real wasabi, man.
But that's what ended up happening. I can't tell you whether that was intentional or it was customary. I like to think it was intentional. I haven't done enough. I'm not a history buff. I only know the history when it's relevant to the actual knowledge of like the human body. But it's something worthwhile to look into. So for us, a lot of the herbs that cultures have started to use, cilantro, parsley, thyme, all have antimicrobial properties. Yeah. So we're even like, if you like get an antimicrobial, like you'll see thyme oil,
basil, oregano oil,
basil, oregano, lemongrass, like all of these things are antiparasitic, antibacterial, and they were used for thousands of years in cooking. Because otherwise, we should all be dead. Like, there should be no humans.
Like, thinking about what could have happened.
Yeah, thinking about what could have happened. Because if we were dealing with all the crap that we're dealing with today, like, everybody should be dead. But now we've kind of gotten so far gone from all of this.
Yeah.
So what we're dealing with is, yes, in meat there could be parasites, in fish there can be parasites. Those are usually the biggest sources that we're seeing that are like parasitic. Bacterial can grow on anything. you know, so like, and then mold and fungus, you obviously have to think a lot about your fresh fruits and stuff like that.
Yep.
You know, the longer something looks like, leftovers are a big source of histamine producing bacteria. So if someone has histamine related issues, I almost always take them off of leftovers.
Yeah. I mean, I'm like, it's even the right people we're in like a meal prep world. I try to eat stuff within a day or 2 days or 3 days max kind of, but even like staying away from the staples for me, I've seen like with rice, right? Like a white rice or like a long grain rice.
Huge for
right?
arsenic and mold.
It's like the fastest, right, growth rate of like a mold or bacteria if it sits on the counter and you refrigerate it. There's like a starch effect, which is great for digestion and blood sugar and stuff.
Right.
Reheating after it's cold, but then it's like, well, if it's in the fridge overnight, it's also going to grow extremely fast, faster than anything else. So you probably shouldn't even have it. Almost,
well, and then we even get to the question of when was the last time you cleaned out your fridge?
Yeah.
Like actually cleaned it.
Yeah.
One of the best things, and if I could just lay this down for a quick, because like someone's probably listening to this being like, I have mold, I don't know what to do.
Yeah.
Ozone generators are really good. You cannot breathe in ozone. It will kill you or make you very sick. But what you do is you take an ozone generator and you put it in a room, close all the windows, you leave. Don't anyone go in there. As soon as you get home, you turn the ozone generator off, you open up all the windows, and then that's the best way to kill mold spores.
Wow.
In the house, other than remediation. Because I know remediation can get kind of expensive, so I tend to say like do the ozone. There's a $100 one on Amazon that you can get.
Really?
Yeah. These super simple.
That's
fixes.
pretty cool.
Yeah. So
That's
nothing
wild.
crazy there.
My
parasite story.
Go for it. Yeah.
So my parasite story is now I've come out of the mold stuff.
Yeah. By the way, I'm doing this because it's interesting and I love picking fun and putting you on the spot, but also because it's useful.
Yeah.
Like first account stories are there, right? It's not against anybody that you listen to or talk to or any doctor you talk to. How many real accounts are out there for I had this, I did this, and now I don't. Aside from it being interesting, but go ahead.
So I was struggling with a couple of health things right around that time where I was like, oh, I got out of the mold and I was doing good. I was fine now, but I was still struggling with some other stuff on the back end. And I was like, okay, let me start like running my own panels, my own labs. And I got good information from the panels and labs. And then I ended up seeing someone who was currently practicing applied kinesiology, which is what made me be like, okay, like I brought the labs and I was like, this is what I'm seeing. This is what I want to treat. I tried doing all my treatments based off the labs and I got better, but it came back. So then I ended up going to an applied kinesiology. It was a conference really. And I saw the guy and I had him test me. I took the supplements he recommended and I had some like really crazy fast results. So I ended up doing a parasite cleanse. Parasite cleanses are fun because you don't know what's going to happen because you don't know what's in there.
Yeah, I've also heard like a couple people do them, and it's like woo-woo type.
Yeah,
like,
yeah,
okay,
no, it's
well, what
woo-woo.
the hell is this, right? And it's like it's not standardized.
It's not standardized.
So that's why I'm interested.
No. So Cellcore is a company that makes a parasite program. They do some timing and stuff with the moon. I haven't seen enough research or results to suggest it. I think if I had a really tough case, I'd potentially, because the idea is that the parasite's growth cycle coincides with the lunar cycle. And I'm assuming I don't know the exact rationale, whatever. But regardless, the people usually do need to do a parasite cleanse more than once because parasites go through different stages. They go through the larva stage, they go through the egg stage. So like if they're in the middle, like if you got like half of them that are in egg stage and half of them that are in the
like any bug or human,
like a tick, right? Ticks go through these cycles, and so on and so forth. Lyme goes through the same cycle. One of the things I learned from the Cellcore team is that like you can actually have like Lyme can hide in parasites. So like you can get Lyme, and then the Lyme can go in the parasite, or you can get parasite that gives you Lyme. So there's
That's
like
crazy.
It gets super super wild. I'm trying not to get too into the details but the point being is that I did a parasite protocol. I remember the second night I did it, so physiologically, your bowels, you should not have to go number 2, take a shit, whatever you want to say for the appropriateness of the podcast. We can bleep these out if we need to. You should not have to poop talk.
Poopy.
We should not have to go to have a bowel movement in the middle of the night. I remember all of a sudden,
You should not have to.
You should not have to.
Gotcha.
Yeah.
Okay. Interesting.
It's
Okay.
typically because you should. Okay.
It's,
So
well, it's funny. Anytime I've had to go in the middle of the night, it's like
urgent.
something's coming. Yeah.
Yeah, and that's usually when you're sick.
Yeah.
Because your body's trying to evacuate something. So the
That,
way
I've never actually thought about that. Sorry, it's just like a sitting on the poop thought right there. Eric will enjoy this too if he edits it. Poopy Eric, poopy. But that is really interesting, actually.
So
Wow, I just discovered.
nobody. Well, you know what's funny is it's like I thought that was common knowledge.
Yeah. Every night I have diarrhea at 2:00. Yeah.
The way it works is that your urinary system, kidneys, and everything still keep filtering throughout the night.
Yep.
So that's why you can pee in the middle of the night.
Okay.
If you still have, like, if you get a full bladder and you get those like stretch receptors affected in the bladder.
Sorry, quick little thing here. I've heard that. Well, for poop that's interesting, but for pee, it's if you have to go during the night, your sleep is slightly interrupted. I've heard that the bladder slightly expands to account for more urine collecting during that 8-hour sleep, right? And then if you're waking up or something, like the only time I have to go pee is when I'm conscious that I'm awake, right? There's been nights where I've slept through the entire night.
Well, you could even
and like I wake up and I'm like, and then as my nervous system comes to, I'm like, oh shit, like I'm full, like I gotta go pee right now. But like most nights I'm like, I'm tossing and turning something, whatever. I'm up and I gotta pee at 1, 2 o'clock, whatever, right?
Yeah.
Which I'm sure is a lot of people. And like as people say that they age or they sleep worse and worse and worse, they pee more and more and more during the middle of the night. Sorry, tangent, but let's get back to the poop and parasite.
No.
That's interesting.
There's ways to fix that, but regardless of that, I've seen things that fix like urination at night, but a lot of times, sometimes it's correlated with blood sugar. Those wake-ups occur with blood sugar because like your blood sugar crashes, then your body starts using glucagon, and then your body starts upregulating the glycolysis from the liver, and then all these different things. So going back to the parasites, really what should happen is at night your brain should turn off bowel peristalsis, so everything should just sit for the most part, give or take. Because the enteric nervous system does work on its own, which is like a second brain. That's what they call like my gut feeling. That's like the brain in the gut. So the
even like farting.
Yeah.
Okay.
I mean, maybe there's
curious.
going to be certain things that are involuntary and so on and so forth. But for the most part, like unless there's something wrong, you shouldn't have to go to the bathroom, and you shouldn't have to.
Love
have
this
a bowel
conversation, by the way. This is phenomenal.
So the first night, I remember all of a sudden, I'm like, I can't trust a fart. That was the first night. It's like, I can't trust a fart.
Steve, is that you right now?
I was like, I can't trust a fart. Shit. Like literally. So I was like,
literally shit.
So I had to like poop twice in the middle of the night.
Okay.
Twice.
That's unbelievable.
I couldn't trust any of these farts. And that was like the same thing for 2-3 nights. And I
you just sit on the toilet and you're like, and you're like, oh, that wasn't poop. That's another fart. Okay.
I don't know.
We're okay.
Yeah,
I could have done that one standing up. I didn't have to.
I've never had that experience before in my life, so I was like, oh, this is wild. So that was a rough 3 nights before I started
the Dumb
to
and
adapt.
Dumber. Cue the Dumb and Dumber poop scene.
Prior to this, though, I was having a lot of loose stools. Like I had probably for 6 months not formed a solid stool. I can't tell you whether it was mold. I can't tell you whether it was parasites. I like to think it was parasites because otherwise the parasite cleanse wouldn't have worked.
Yep.
Now I have fantastic bowel movements again. But that's
I'm interested.
You're interested? They're fully solid.
That's
they're
good. Well, that is a huge thing. That's a huge thing. And even right. Researching stuff because we got a puppy, Louis, a year and a half ago. You watch a dog go around.
People get a lot of parasites from the dog, by the way.
Really? Oh, no.
They lick their mouth. They lick your face.
Shit.
And then they give you parasites. So like,
okay,
then you're like, your dog's having loose stool. You're having loose stool. And it's a party.
So I was gonna say like just researching like dogs pooping habits because we're training him. Right, a dog always sniffs their poop. They turn around, they sniff it. All German Shepherds would eat it as like a survival thing because that's that pack of family, right? But researching that and seeing that they actually sniff it because the smell and the look of the poop for them, it's inbred. It's in their genetic predisposition as of that animal species to know when their poop is good or bad. And if it's off, they know they're unhealthy, right?
That's cool.
Which is pretty interesting. Yeah. So like a solid, perfect dog poop is literally like, I'm like happy when that happens. And I'm like, fuck. Remember one night he had a couple pieces of bacon by accident. I was like, fuck. And just like all around the yard, all like for like hours, right? And just like, fuck.
I was there. Oh,
That
I
was
got
you.
my puppy. That was me, and that was my puppy.
But really interesting, right? Really interesting that like how much are you looking at your poop,
Mm-hmm.
what it smells like, looks like, right? Like it's really interesting.
I look at it very intensely.
I mean, you should. Everyone should look at their shit, right? Look down in the bowl.
Yeah.
Because it tells a story. It tells what's going on, really. And
Mm-hmm.
I like I said, for me, it's attributing like, what is it? Why is it soft? Why is it like this? I eat a ton of protein. I eat, right? Like, what are in
you
the
having
products
enough
that I'm eating?
fiber? Are
Yeah,
you having,
probably not half the time.
Right.
Right. The apple crisp with vanilla ice cream on Monday and Tuesday night.
Mm-hmm.
It was good.
Hopefully not a source of parasites. Most likely
It was
not,
good.
but
They're baked in there.
So I ended up doing a parasite cleanse. I used a couple products from Cellcore. Had really good results with those.
Okay.
I do know that like every now and then, sometimes like we get like I'm trying to always find products that don't create what's called a Herx reaction. So a Herx reaction is due to bacterial die-off, but there's also some theory that it's also due to your body rejecting the supplement as well.
Okay.
So I don't know which one it is. For a long period of time, we just thought it was due to bacterial cell die-off or approaching something too fast. I had a little bit of Herx reactions. I'm always willing to push through them as long as I know it's going to, clearly. But then I ended up trying. So I did that, worked really well. And then I was interested in doing a coffee enema. So one of my mentors...
I've heard of a few people doing them. Ben Greenfield actually was one of the original ones, like probably 8 or 9 years ago. I've listened to his podcast since it's like original.
Do you know how they came about?
I don't.
Okay,
no.
so
then Blink-182's Enema of the State album was also went through my head of like they named it Enema of the State because of enemas. Because it was fun butt stuff, you know.
Yeah.
Go ahead. How did enemas
come about? So coffee enemas, the guy didn't invent them, but the Gerson Institute is the one that promotes them the most. So Dr. Gerson ended up getting a lot of patients with cancer.
Okay.
And what he would do is he would put them on juice cleanses. So if you go to the actual Gerson Institute, like their whole program is juice cleanses mixed with coffee enemas. And they have really good results showing really good changes in people with cancer and with all these different things.
Wow.
They actually I'm pretty sure, I hope this is him because I hope I'm not telling the wrong story, but I believe they brought him to like federal court and sued him because he said he was treating people with cancer. And he actually had 48 of the 50 people he treated come up and testify that their cancer was gone. And they had to let it go because they were like, clearly he treated their cancer.
Yeah.
Because as a clinician, I can never say that.
Yeah, of course.
Even
you can't
as
state that, even like
anything,
right?
So
in the
even
world, like
even as
supplements.
a chiropractor, because that's what my license and scope of practice is. I can't say like I'm not treating someone's Crohn's. What I'm doing is I'm helping them improve their nutrition. Does that make sense?
Yeah.
So I'm not treating their parasites or I'm not treating their infection. I'm helping them. I'm helping their bowel movements, right? So like that's like the bold disclaimer. I always got to include one at some point. But the way the coffee enema came to be was he was treating all these people with cancer, and what happened is all the cancers were getting pushed to the liver. So all these people, he'd put them on the juice cleanses, and they would get crazy liver cancers, like months later. And he was like, "Fuck, I don't understand what's going on." And then he found he didn't invent the coffee enema. He found it, and he's like, "Let's try it." And what would happen is the purpose of the coffee enema is that the normal material that's in coffee that gets broken down by the stomach doesn't get broken down if you take it rectally. So as you hold it in the intestines for 15 minutes, there's this cycle that occurs where it's absorbing and the liver's secreting. It's absorbing and the liver's secreting because there's this thing called the hepatic portal system. The hepatic portal system, what it does is it pulls, so everything that you eat, aside from, can't remember how fats are distributed, but for the most part, everything you eat, because fats get absorbed by the lymphatic system and lacteals, but for the most part, everything that you eat gets taken into the hepatic portal vein and then goes straight to the liver. And once everything goes to the hepatic portal system and goes to the liver, it gets processed. And this is our safety net. Because otherwise, if you ate poison...
Cleansing, it's the cleanse.
It's the cleanse. So otherwise, if you ate poison, you get immediately detox. Like, you'd be, everything would just get through straight to blood circulation. Mm-hmm. And that would be like, for example, if you drank alcohol, you'd feel it immediately. But there has to be this process and delay process, and that's how it gets cleared. So for the most part, what ends up happening is these things get cleared by the liver, and then they get excreted. Anything that gets bad or gets processed through gets excreted into the bile duct, and then either goes into the gallbladder and then gets excreted, or sometimes it goes straight through the bile duct because it's like this like little like fork, like little Y, like a tube. So the process then is you absorb the nutrients from the coffee, goes to the liver, and then it pushes things through. The intention is also that it actually widens the bile duct. So if you have gallstones, you might be able to push them out. I pushed out gallstones.
That's crazy.
Which is crazy because they look like tiny chunks of like.
And did you know that you had a gallstone prior?
I had suspected it because I was having reflux, and I thought it was potentially biliary reflux because it seemed more related to fat style foods. I also know that my dad had to have his gallbladder removed, so that's always been something I've been more like concerned about. And typically, what ends up happening is just because my dad had it doesn't mean I have to have it. So either I have to take strategies that prevent it, or I have to see what in his history of living his life led to that problem. Do you know what I mean?
Yeah.
So for me, the big thing's probably like liver gallbladder, and that's always a thing that I struggle with is liver gallbladder. I'm more susceptible to it. Is it because of dietary patterns? Is it because of the mold, the fungus, the bacteria? Probably more of those. But yeah, for the coffee enema, he found that by putting in the coffee enema, it created enough breakdown and clearance in the liver that people were able to do. So for me, I know I have liver problems. I tried treating them with the traditional supplements. Kind of helped, kind of didn't. The number one herb people recommend for liver is milk thistle.
I've heard that.
The problem is like 85% of milk thistle is contaminated with mold. So if you're using milk thistle to take out mold, you're like, so that's unfortunately part of the problem. So I didn't have as much of a good result on milk thistle. The coffee enema probably provided me the best. Coffee enema, saunas, and then I think there was another liver support herb I used. I can't remember. I think it was just Sandra. But regardless, so that's how the coffee enema works. So when I had it the first time, I think I was able to. So it's no one prepares you for how hard it is to hold coffee in your rectum, which is a statement that I don't know. I'm like,
how can people train for that?
Daily coffee enemas. So
super clean.
I think I was able to hold it in for like 12 minutes out of the 15. I felt like a champ because I was like, I got pretty far. I said in the video.
You tried to do a squat with it and everything, like perfectly aligned.
Really hold it in.
Deadlift.
You actually lay on your. I think you lay on your right side. Is it right side? I can't remember now. I'd have to look up the instructions, but I think it's right side because then it pulls. Yeah, because it goes up and then in.
Okay. Oh yeah. Okay.
Messing things up here. So it's easier to hold it in. So
they're gonna love
or
to
maybe
edit
it's the left
this one.
side. No, I can't remember because maybe it goes with gravity. Whatever.
Poop emojis everywhere.
Poop emojis everywhere. I hope this flood the
poop,
screen.
Poop, mycotoxins, and enemas.
Hopefully Eric's editing this and just has
100%
bunch of things up.
He's gonna love it.
He's gonna love this.
Weird guy, Eric.
So I ended up pushing out what looked like liver flukes.
Okay.
So those are parasites that live in the liver and the gallbladder specifically, and they end up causing a lot of problems. So they can cause gallbladder cancer, or that's usually where people sometimes need to get the gallbladder removed. So I was like, oh, maybe I picked this up in childhood. Maybe there's I don't know how it got spread between family members.
And they'll like a parasite potentially could just be in you for
forever.
Wow.
Yeah, unless you're removing it. So like I think that there's value in doing parasite cleanses, within reason, because like there are some herbs that are really good. Like Mimosa Paducah is an herb, which is like that's like the herb people are talking about the most now. Pretty much what it is it's kind of like this. It forms this like gel-like substance that starts to bind a lot of things. Some people call it like the intestinal scraper, but it's nice because it works at getting stuff out. And it's really good for like reformatting the microbiome. And I have
for some of the. Sorry, go ahead. Finish your thought.
I have patients do it, and they love it. I have not yet gotten anyone to do the coffee enema. No, I somehow can't convince anyone.
Is there
to
actual
do it.
first for the herb? Is there are there certain like directives like, hey, this person's going to do well on this or that? That herb you just spoke about, like dosages and frequencies. Is it like over a month they'll see certain cleansing happen, or is it like?
So typically it's that fast. Sometimes we'll see it in as little as a week. I noticed my bowel movements changed in as few as like 10 days.
Okay. And then for the enema, what have you seen since? And like, what was your mentality going into it and being like, all right, like we're going to do this, whatever. And then afterwards, what was it? Was it totally fucking worth it? Like,
yeah. I would do them routinely. You know, we live the reason I did the coffee enema wasn't necessarily for me, because I was like, I have to do this. I had a inkling that I would try it at some point for liver cleansing, because I was like, I just haven't found. I have everything on a spectrum, so it's like, for me, for most people, sometimes it's like, okay, they just need more cruciferous vegetables to help with phase 2 detoxification. Then they need a supplement. Then they need liver, like super liver support, which is like the coffee enema. And it's like, hopefully no one ever needs to get there. I probably did. I'm grateful I did it. I'm going to continue to do them. The thing I noticed immediately after was I felt great. It was like, have you ever had like an awesome workout sauna session? Just like, and you're just like, everything feels great, clarity.
You're almost like, it's almost like that high lifted like feeling you get if you're like jittery or like cold, but you're not shivering and jittery, right?
It's that's like, exactly how I felt. And I was like, I had a little bit of like an hour or two, like almost like that flu, like oh, like maybe I overdid it, kind of feeling. And then the rest of the day, I was like, I have more energy than I've had in my entire life. And I was like, fuck, I feel great. And that's where, like, honestly, people who have liver issues respond really quickly, because the liver is such a metabolic organ. Same thing with heart. People who have heart issues sometimes will respond really fast to therapies, because the heart's so metabolically active that the heart cells are replaced like every 30 days.
Wow.
So the liver, I think, is every 60 to 90 days. So, you know, when you have a metabolically active organ, if you do the right stuff for that organ, it rehabs really quickly.
Wow.
But to test, so this is why I got back into the applied kinesiology testing, because like I needed even if it was not fully scientific way, to test people that I feel comfortable will give me at least a good answer, because otherwise it's luck of the draw. It's like, I go through the research, I go through their lab testing, I look at the supplement and I go, okay, this supplement says it's going to work, but how do I know it'll work for you? Because I could give you, because even medication is the same thing, and I hate the let's try it and see approach, because that's pretty fucking like shitty. So like, you go to your pharmacist and you get let's say an antibiotic, doesn't work. Then you get another antibiotic, doesn't work. You get another antibiotic, doesn't work. Wouldn't it be great if there was a way to tell you if you could respond to this one antibiotic? Yeah. That's what I'm looking to do with the muscle testing, because if I can at least get the person to taste the supplement in my office, and I can check for a relative strength weakening. I'm trying to see if I can do dynametric evaluations too, to see if I can get if I can quantify
force production, physical force production, dynamometer. Yeah.
Because I'm like, can I show quantitatively that there's an actual weakening response to the supplement, or there's a strengthening response?
It's literally like, is it kryptonite or steroids? Is this kryptonite or steroids? That's kind of interesting. That's crazy.
It works that way though, because like when I got back from the most recent seminar I did for the muscle testing, I went back and checked my wife, and like she's got like if I were to test her like pec minor or pec major, it tests weak every time. Like I can't, like she doesn't have the strength there. I give her, and that's actually correlated with like liver stomach depending on the head. So I gave her I had her take a liver support herb, and what it does is it works through the gustatory reflex. So I've had trouble explaining this until there's a new device that came out called the PONS, PONS. PONS is also the name of part of the midbrain.
Yep.
So the PONS is a device that you put on your tongue, and it uses electrical stimulation to stimulate the gustatory reflex of the taste buds, to stimulate parts of the brain, and it helps with Parkinson's and MS patients. And I was able to say, oh, this is how the fucking AK stuff that I learned 10 years ago that they knew 50 years ago worked. When you have a gustatory reflex, it will stimulate and upregulate certain portions of the brain, and then we can get neurological changes. Maybe it's, as long as you're getting that taste sensation, you still get it.
Yep.
So what I'm trying to do is figure out how can I bypass maybe the taste sensation, but as of right now, that's as far as I've gotten. So that's what we're doing to check to see if people actually respond to the supplements, because I don't want people to have bad responses or even okay responses. I want like super strong responses.
Wow.
Cool, right?
It's fucking great.
It's fucking wild.
I've asked you this before. What do you think are the limitations, the capabilities, and I mean, you don't know the limitations, but the capabilities of your practice, of the true applied discovering pathways that you can kind of go through and find for individuals to deal with almost any issue that they have. Are there any, I mean, even what are you going to try to push? Like, what are you going to try to find? Like limitations? What would you like, where would you like this to go? Right?
Oh, that's a good question.
And what do you think the capabilities are?
Capabilities truly are endless. The limitations are often the people. And I've had this conversation with my wife
The limitation is you.
The limitation is you because it depends on how much people are willing to put in the work. And I think this is the same thing that we're noticing with people on the weight loss side.
Mm-hmm.
You know, can you lose weight? Yes. Are you willing to do the work that's required? You know, the limitations is that it's not easy. Like, it's not easy to like, and I say like, because the disease itself or the condition itself sometimes can be a limiter, because if you have a colostomy bag,
Yeah.
like it's gonna be really hard for me to fix that. If you have like your gallbladder taken out, there's a limitation there. If you're on certain medications, there's a limitation there. If you're willing to like want to like if you're looking to get off the medications, sometimes potentially it's not. There's a lot less limitations.
Gotcha.
So like those are some of the limitations, but most of the time the limitations is the person and how much effort they're willing to put in and how much work they're willing to do, because it takes time. And I think that's sometimes what people don't understand. We all want a quick fix. We want things to be over instantly, but nothing ever started quickly.
Mm-hmm.
Everything takes a long time for it to develop. Where I want to see this go, and this is what I'm really trying to do, is I'm putting together this really strong framework. And I feel like I've almost got it nailed down, where it's a combination of the functional neurology work I'm doing, trying to get my diplomate. It's a work with the functional medicine. There's the visceral mobility component, and there's now the applied kinesiology component, where like I can bring someone in, they can present to me their problem. I can put them through this really like even more comprehensive than I've been doing for the last 3 years.
Yep.
Even more comprehensive than that screening process that takes maybe 2 hours. And we can figure out exactly the weak points in their body that we have to target.
That's incredible.
Because within that 2-hour appointment now with this new stuff, I can tell you whether you have a fungal issue, a mold issue, a heavy metal issue, maybe it's a hormone imbalance. I'm getting that information now. I can use the applied kinesiology to confirm it. I can use it to figure out what organs are potentially affecting that problem.
Yeah.
And now we can figure out from both a nutrition or a medical approach or a chiropractic approach or a neurological approach, all the stuff that we need to do.
Total holistic approach, yeah.
You know, even just like there's a thing called the brain driver. Maybe it's something as simple as we need to upregulate certain portions of the brain.
Yep.
Because that's what we need to do to get all those things firing. And then
it's crazy.
It's the amount it's endless. Like it truly is.
The capabilities.
The capabilities
are
endless
ceiling.
as long as people are willing to change their patterns.
Yeah. Well, that's anybody lifestyle, right?
That's true. But it's out there. Like the solution is out there. You can solve the problem. Don't give up. I never gave up, and I'm trying to be here as that living testimony to be like, I'm not giving up. You don't give up either. Does that make sense?
Yeah. Before we wrap up, what are a handful of maybe immediate things people can do to improve their overall well-being, or low-hanging pieces of fruit for them to look for to start doing or change? Or avoid. Right, so, the biggest markers. If there were like a top 3 to 5.
So what I really like is the easiest one is waking up in the morning and getting sunlight.
Yeah, that's always, I feel like, number one for me.
Always number one, because what that does is it regulates cortisol rhythms. It'll help with morning cortisol secretion. It'll help you get out of bed easier, and it does so much with that cortisol rhythm. And then once you get that cortisol rhythm and you can start working on your sleep, then you're good. Making sure that honestly, this is more from the chiropractic perspective. You need to make sure your bed and mattress are good. And your pillow and your sheets, they should all be clean. And I know it sounds like kind of like silly stuff to think about, but like when people are sick, like it's some simple stuff that matters. One, from a perspective of that, molds can grow actually in pillows and mattresses that people don't think about. And two, you want to make sure you're getting a restorative night's sleep, whatever that looks like. Whether it's like, okay, maybe you need to make it more dim, maybe you need to work on the temperature, maybe you need to change out the bed. People need to do that. and it's super important. Shoe footwear, super important. PRI has a shoe list. I've seen so many conditions resolve just by getting the right footwear on people. I've seen people's eyesight improve by getting the right footwear on people because there's receptors, and you can do the research, look this up. I've also seen that there's a lot of good information with, like, obviously, like, the traditional of stop eating processed foods, start eating more whole, nutritionally balanced foods. If you're dealing with a mold issue, you gotta work on getting rid of that mold, so that ozone generator is super helpful. If there's a water leak, you gotta get it fixed.
Is there an easy mold test someone can do in their house?
100%. I think it's immunolytics.
We can link it in the
yeah.
bottom of the podcast
I'll give you I'll look up the link after. I think I want to say it's immunolytics, but in the
because that's major. That's cool.
Yeah, they have home mold testing you can do. They give you agar plates and stuff like that. And I think you can set. I think they do. I think for like it's like $30. It's super cheap. And then you can mold test. And again, that doesn't mean that necessarily that you're going to be susceptible to it or your sensitivity is there, but it's better.
Can't hurt.
There's actually been cases, not to dive off too much, but there's been cases where people get old furniture that has mold in it, and that's what triggers their symptoms. So maybe stop yard sale shopping. My parents were yard sale people for their whole life, and I'm like, I hated it, but they know I hated it. So this is not anyone calling anyone out.
Cool.
So those are just a couple things that people can do. And then the tap water. You need a really good filtration system, steam distilled if possible, but making sure that your tap water is really good. It's huge.
And then any filtration system. I mean, I don't know if there's any that you'd recommend. And then, like,
steam distilled is the best.
Is there an easy way to add just a mineral back to the water, whether it's like a salt, simple salt, or just like an electrolyte supplement that contains them? We can link it. We don't have to go into it.
I like Redmond's. Salts.
Cool. Phenomenal.
I think that
Based out of
they're
Utah,
the best.
right?
Yeah. You know, it's the one thing that really sucks is that they're all getting hit with these California lead warnings.
Yeah.
So people are now getting hesitant about buying it, and it's like there's trace minerals and everything. Yeah. Sometimes you want those trace minerals, but those are the best electrolytes that you can potentially offer. Reverse osmosis, people tend to do really well with filtration system wise.
Okay.
Again, steam distilled is like that next step where it's like it distills everything, but those are super expensive. Yeah. So if we're better than nothing.
Cool. And then where can people find you, contact you, see some of your stuff?
Yeah. So our company's called Good Life Health after the rebrand from Kinetic Chiropractic. We're on Instagram. My Instagram handle is at Dr. Mike Fucci. You can find our content online. We're going to be trying to push more and more content out there about functional medicine. Hopefully we start getting the YouTube channel up because I think that'll be a better medium for me to be able to educate and really explain a lot of these topics to people. But our office is located in Plainview. We do see people virtually for the functional medicine services. All our neurologic and chiropractic and applied kinesiology services are in person. But we do get people who come out of town. We get people who travel. Sometimes we do a 3-day weekend for a lot of those people.
Cool. Awesome. Thank you. There you have it. The Wildlife Podcast, revamped. Dr. Mike Fucci.
That's great.
Appreciate it.
Thanks so much.